Hello and welcome to another episode of the Femme Frequency. Today we're going to be discussing an interesting topic, something you've definitely seen, definitely heard of, so we have to talk about it. And I'm talking about the use of GLP medication for weight loss. You see, I told you, something you've definitely heard about. So to help me unpack this hot contested subject, of course I need to get the expert into the room. And for that, please help me welcome Dr. Chanell Marthinussen.
Hello, thank you.
Welcome.
Thank you for having me.
So good that you can be here and that we can cover this trendy and much talked about topic and conversation. So I'm going to jump straight into it.
Yep.
Doc. So GLP-1, can we say that's the umbrella term and then there are lots of brands under it? But if you can just start off with what's the initial use of this? You know, what is the purpose of this medication?
I think that we should start with what is GLP-1 because a lot of people are saying it everywhere and they're not really sure what it means. So GLP-1 stands for glucagon-like peptide 1. Okay, so this is actually a natural hormone in your body that is given off by the intestine when you eat something. So this hormone tells your brain that you are now full, it regulates your blood sugar, it slows down gastric emptying. So that's normal to happen. So when we take, these glucagon-like peptides that we are taking in injection forms or tablet form, it's actually just attaching to those receptors in the body. So we have these GLP receptors all over our body, actually. It's in the brain, it's in the heart, it's in the pancreas, in the liver, it's in the kidneys, in the GIT, in our fat,
everywhere,
adipose tissue, even in the muscle. So if you think about it, the GLPs are actually assisting you holistically. So it's actually affecting the whole body, not just your fat. So GLP, glucagon-like peptide 1, and there are many different brands so a lot of people have heard about Ozempic. That was the first kid on the block, the oldest one, and then those are semaglutides, and then there's also Wegovy that's more recently. Then there's tirzepatides, which is a dual action with GLP and GIP, so it works like as a double dose to actually lose the weight. But initially, GLPs were obviously used to treat diabetes because it does help to control blood sugar. And then eventually the researchers saw, this actually helps us lose weight as well.
Yes.
And then they've just formulated in higher doses, higher dosages, and now people are using it everywhere for weight loss.
That is so interesting. I mean, what an explanation. And we are now talking about it as a weight loss sort of tool.
Yeah.
And we've seen an increasing amount of people using it. And I think from 2021, you know, it started becoming really, in our faces and you hear about it all the time. Yeah. In your personal opinion, using it for weight loss, how does that affect us?
Initially, it was all this big craze about we shouldn't use it because the diabetic patients need it. There was the thing about it running out of stock. Was
that true?
We were running out of it for the patients who needed it because now everybody was using it for weight loss, but it's been around. It hasn't been only since 2021. It's been coming for years and years and years. We're only now hearing about it, and as being in South Africa, only 2021 we heard about it. And now at the moment, there are even newer ones being formulated that nobody's knowing about yet. And it's not, let's say it's not regulated yet or it's not approved yet. But there are ones that we're actually working on that are being worked on and it's just not known about yet. But it's actually been coming for years. So it's just been a long time coming. It's just that we now know about it.
Yeah.
Personally, I have patients who I have on it because obesity is such a chronic condition, actually. That's actually the root of it. So I would much rather treat my patient to be metabolically healthier than to just treat the diabetes or the hypertension. Because at the root of it, it's actually the obesity. And obesity is actually a chronic condition, just like hypertension and diabetes. And that actually leads to all the rest of the issues that patients have.
Okay. I love that you mentioned that, and we're going to get into all that nuts and bolts as we carry on with the conversation. But who is the ideal person to be on this treatment?
So if you look at the definition, your BMI needs to be above 30.
Okay.
Because that would classify you as obese. Or BMI over 27, but with the obesity conditions like cholesterol or diabetes or hypertension. And then my ideal patients that I see almost every day would be patients who have really been struggling. They've actually done the work. They've actually exercised. They're actually eating a calorie deficit diet. They're actually taking in more protein. And they actually still are not losing the weight. Because obesity is not just a matter of willpower. It's actually so much dependent on genetics and environment and hormones, and mental health even plays a big role. So I think ideally it would be a patient who fits that criteria of the BMI, but also the patient who's actually started with the work of exercising, of putting in the lifestyle changes, but they are still not seeing results because it is unfortunately out of their control. It's not something that they tried, but it wasn't working, and they just need a little bit of help. And I see it as just that bit of extra help, support, and then you get to your goal, and then to maintain it with your lifestyle. It doesn't mean it's going to have to be, forever. You still need to go back and maintain it with your lifestyle changes.
So I'm glad you mentioned that, because I think the misconception out there is that this is a magic pill, right? This does wonders, or not even a pill, but how you can tell us how you use it. That you just do this injection and it works wonders, and you can just carry on with your life and live the way you want.
Yeah.
But to just zoom into that supplementary things that you need to do, and you mentioned a bit of it now, the exercise, are there any sort of food groups that you need to take in at a higher volume? Tell us about that.
Yeah. It's definitely not a magic pill injection. It's not a magic drug. I always tell my patients when they come to me, I would say, are you exercising? Are you eating a calorie deficit diet? Those things need to be in place first before I'm going to prescribe it. Because I can prescribe it, but it's going to be as an add-on. It's not going to replace the lifestyle. It's not a replacement of all of those things. So when I say lifestyle changes, I would mean resistance training, cardio for about 150 minutes in a day, or I would often tell my patients, rather just start with 1 day a week, just start somewhere. Walking even is can make a big difference. And then the diet comes in where it would be calorie deficit, more protein, less carbs, because also you don't want the medication, we don't want it to lose everything. It must actually help you lose the fat, but maintain your muscle. So that's why we say protein-rich diet to be added to it. Water intake is just as important. Your behavioral support is also very important. So I said diet, mental health. So all of those help. That's why I think it's so important to rather speak to a healthcare professional about it and not just get it wherever at some spice shop that you can get it from.
Or a random salon.
Yes, because nobody's monitoring, nobody's checking the adverse effects, nobody's checking that you actually are losing the weight, that you actually still need it. So I would prefer that there's monitoring in place with it. But then all of those added things, need to be there. So lifestyle changes. So I don't prescribe it unless my patients show me that they've tried to do it the more natural way. And then we add it as a support. To make this as practical as possible, when you say, up the intake of protein, we're talking about chicken, eggs, beans. Meat, fish. Less carbs. So people think like sugar, they must just cut out the sugar. But things like rice, things like pasta, things like bread, all the nice
we are in winter
things. I know, so it's very difficult to have this conversation right now. But all of those white carb things actually break down into fat, into sugar. So it breaks down into glucose. And every time we take those things in, there's glucose in the blood, so that's sugar in the blood because it's broken down. Then your pancreas is like, oh my goodness, there's so much sugar, and then it is awake, then it's working. So every time we're taking in those bad foods, it actually is making your body work so much harder. So you're actually trying to just keep it at a more steady state. So that's why things like low GI bread might be a better option.
Is that good?
Because it's GI stands for glycemic index. So it means that the glycemic index just goes a little bit up. So every time you eat it, your glucose doesn't shoot up to the roof.
Okay.
It actually just keeps it more stable, whereas normal bread would make it go like that all the time. And then your insulin goes like that all the time. And then your pancreas is working harder. And then people get pancreatitis, and then that's when they get diabetes, and it just is a whole cascade.
All these big words. Yeah.
Yeah, so it's just a whole cascade of things. But I would rather say that balancing the diet. So even yesterday, I spoke to a patient who, I was telling him, on your plate, there must be half veggies.
Yeah.
And he was like, he laughed, he looked at his wife, he was like, it's definitely not like that. And he's diabetic. Quarter protein and a quarter like a carb, something. You can have it, but I think to portion with caution is important.
That's a nice one. Portion with caution.
Yes, so I think if you can just portion your things, it will be helpful.
Not to make this a nutrition talk, but do you think we should go back to that 7 colors living? Like, where you see the 7 colors on the plate.
I think so. I think it is
sure
helpful.
that you're getting in the veg.
Yes, I think that will be helpful.
Okay, great.
Yeah.
So we're talking about, how to monitor this and how to administer it safely and use it safely. So what is a safe way? Okay, there's an individual that's using Ozempic, say for example. What is a safe weight loss number?
Oh, the number.
Yeah, the number in terms of and the timeline. So in months or weeks.
Okay.
Yeah.
So I was going to start, before I get to that, just remind me if I don't answer the question, but before I get there, I think the journey to getting there is very important. So when you decide, okay, I want to now get some support for my weight loss, you'll see your doctor. I generally do blood tests. I think that that's important.
Okay.
So that would be the first step before we start the actual injections, to check that the thyroid is fine, to check, we'll speak about the adverse effects soon, but to check the thyroid, to check the diabetic test, how your HbA1c is doing, those types of things as a baseline. So I would do that first. Then once you're starting, it is important to start low and go slow. So we always start with the lowest dose, so that for the side effects, so that your body doesn't get a shock.
Into complete shock. Yeah.
And so that's why I would generally start the same dosage for 4 weeks and then increase it after the 4 weeks. Then another 4 weeks, then you increase it. So only every month you are increasing it.
Okay.
And that means, so if we're thinking about it being over months, let's say you get to the maximum dose. Let's say Ozempic, you'll get to the maximum dose in like month 4, because you only start with 0.25, then 0.5, then 0.75, then 1 milligram. 1 milligram would be the max maintenance dosage.
Okay.
So when you're on month 4, you're only really then going to see the changes. So I would say if you can lose like 0.5 to 1 kilogram, maybe in a week, that should be fine. And over
1 kilogram a week. It's not too bad.
It's not too bad, but you may not see effects when you're on those lower doses. So you only might see the effect as you get to the higher doses, because it's not, therapeutic yet. You're just getting your body, just giving it a little bit to get used to it, then you're increasing it a little bit. And I'm all about starting low and going slow, so that and I've seen the least side effects when we do it that way. So I would say 0.5 to 1 kilogram a week should be fine. Okay. And then over like a 6 to 18 month time period. Okay. We definitely don't also want to go rapid weight loss, because that's also not a good thing. There even are side effects where that's concerned if it's too fast. So it definitely needs to be a more gradual process. Steady, and it's a lifestyle change. It's not a quick fix. And what concerns me is that people think it's a quick cosmetic fix, that they're just gonna, it's gonna be a quick, and that's how our lifestyles are. We think things are gonna be, we want to, our lifestyles are thinking things must go quick. We must just get results. Where it actually should be a gradual process and a lifestyle that we embarking on, a healthier lifestyle. It's not supposed to be a quick thing. So I think a 6 to 18 month time period is a safe period to look at.
Are there some brands that are stronger than others? For example, if you have to compare Ozempic to, I think you mentioned Wegovy.
Yeah. So remember I said the GLPs they are semaglutides and tirzepatide.
Okay.
Semaglutide would be Ozempic and Wegovy. Mounjaro is tirzepatide. So I wouldn't say stronger. I always have the conversation with my patient. There's no one size fits all with me.
Yeah.
That needs to be a conversation. It needs to be about what is your budget? What is your goal?
Okay.
What is the goal actually at the end of the day? A lot of my patients don't really want, yes, the weight loss is a good thing, but a lot of them actually have less back pain, less, costochondritis, less, their blood pressure is better controlled, their sugar is better controlled. So overall, metabolically, they are so much healthier. And that's why I am happy to give it to them, because holistically, I can see a better patient at the end of the day. It's not really about the weight loss so much.
Okay.
So I wouldn't say better. It's just that we do know from research that the tirzepatide is dual acting. So it does act on GIP and GLP. So that works on two different ways in the pancreas. So you could say it works a little bit better, but stronger, because it's
also
working
sounds a bit more expensive.
Yeah. Yeah, that's how we have a conversation about budget.
Yes. Okay, and you mentioned side effects as well.
Yeah.
Please, can we talk about the side effects?
Yeah.
You read about all of these things about dizziness, and what's the real thing?
They are obviously the very common ones that can be like GIT ones, so nausea, vomiting, diarrhea, constipation, abdominal pain. But you can also get that with lots of other medications. It's not only, it's not
usual,
it's not that it's so crazy, the side effects. It can, however, get better, or it can get worse. So we would rather say to stop it if it's not getting better. But generally after the second week, that's how we start low. That's why I said we start on the lowest dose, then we go up after 4 weeks. And it's not the next week, it's 4 weeks of the same dosage. Then you go
and
up.
then you change. Okay.
Yeah, so that is where we see the least amount of side effects. Then there are the very dangerous side effects that can happen. But again, it has been researched so well that it actually, overall, it's not, the side effects are so rare. So the reason I do the thyroid test before I would start patients is because there is a very, very small chance, like less than 1% chance, that patients with a family history of a certain type of thyroid cancer can get thyroid cancer. So that's obviously a big side effect.
Yeah.
But the chance is very low. The risk is very low. And then there are side effects or adverse effects that can happen would be like pancreatitis, because now we're obviously working with the GLP, working with those receptors.
Yeah.
So the pancreas can get affected. The gallbladder can get affected, because remember I said there are GLP receptors in the liver. So gallstones, gallbladder disease, those types of things. And then talking about when you rapidly increase or when you rapidly treat your blood glucose, it can also cause like diabetic retinopathy that some patients get when they have diabetes.
To say that in English. Yeah.
So when patients get when they have diabetes and they have changes in their eyes, which are complications of diabetes, but now you are on this thing that helps it can happen very quickly, and then that can actually get worse.
Okay.
So that's why I said we don't go too quick either, because the diabetic retinopathy can also get worse. So those are some of the like very serious side effects, I would say.
Yeah.
But in general, a lot of my patients have just had like the nausea or some reflux maybe.
Okay.
Maybe a bit of dizziness. But generally, if they needed to be on it, they generally don't have that many side effects.
Okay.
They generally tolerate it much better. And if we've started off low, then they generally don't have such bad side effects. Yeah.
And I think that also just speaks to the importance of doing this the right way.
Yeah.
Like you need to consult your medical practitioner.
I would not say to just get something. You don't know what you're putting into your body.
Exactly.
Also, firstly, you don't know what you might be doing more harm than good, actually.
So speaking about putting it into your body, how exactly are we injecting ourselves? How exactly are we putting it in?
It's like an insulin needle. So it would be like an insulin little needle that would go in under the skin. So it's just subcutaneous. Yeah.
Okay.
Yeah,
at home.
So a lot of diabetic patients are used to injecting themselves with insulin.
Yeah.
So it's the same way. So it would be the same way. It's not an intramuscular injection, so it doesn't have to go deep.
Okay.
The needle's literally the short.
Okay.
And it just goes under the skin. So we call it subcutaneous, and then it just goes in. So on the stomach, we would separate the stomach into 4, and then the 1 week you'd go there, 2nd week you'd go there, 3rd week you'd go there, 4th week you'd go there. Then you can also do it on the thighs. Because we just want to go under the skin. We don't need to go into muscles. We don't need to go anywhere else. It's just under the skin.
Okay.
So it's a quick little injection. It is a bit daunting. So some of my patients rather just come to me and let me do the first one.
I mean, I can imagine.
Show them, because some of them are pens. So some of them you can turn and click. Some of them you'd have to draw up and then put it in the insulin needle.
Okay.
So it just depends on which one you're actually getting. The quick pens are a little bit more expensive because it's obviously it's more, it's just like a little bit more sophisticated.
Yeah. You're paying for the convenience.
So you're paying like thousands more.
Oh.
Whereas the vial that you would draw up would be a lot more affordable. So that's why that's why I'm saying it's not just an easy answer. It would need a consult with a doctor who understands it.
Yes.
It's
and
not,
they can walk you through it.
Yes. And so what we do also, we've got Oran Performance, where we actually take our patients on a journey of a guided journey of it. So it would be the doctor consult with the coaches to coach you through, because people don't know what to do at gym. They don't know how to exercise. They don't know what they don't want to do it. So they need someone to force them to do it. There'll be like dietitians who can actually assist with the diet. So it needs to be a holistic approach. It's not a magic.
Definitely. And I love that holistic approach, because I think at the end of this treatment, somehow you need to learn how to also survive.
Yeah.
Possibly when you're not on it anymore.
Yes.
But we're going to get to that conversation.
Yes.
But what I want to touch on is the affordability. It kept on coming up now.
Yeah.
And I'm wondering access. So who has access to this? Is it if you have a medical aid, or is it like a cash thing? Is it, who has access to this?
In our practice, we have cash and medical aid.
Okay.
A lot of the medical aids are not covering it if you don't have diabetes.
Cosmetic.
So if you have diabetes, they might cover it. If you actually are chronically diagnosed, and you actually, we've now done the chronic application for diabetes, then they may cover. So some medical aids are better than others. We feel, though, that obesity at the crux of it is the root of everything else. So why not just make it a chronic condition that people can apply for and actually get covered with it? Because it is expensive, though. So obviously they're going to be paying, it's a lot for the medical aids to pay. So in general, I've been seeing cash patients do it. So private patients. So patients who can actually just afford to buy it from the pharmacy.
Okay.
They would rather do it because their medical aids, even if they have a medical aid, it doesn't cover it. So these are now patients who don't have diabetes and are just using it for weight loss. They would have to buy it at the pharmacy. Some, like I said, Ozempic was the oldest ones. They start off a little bit more affordable and sort of stay at that amount-ish. But then the Wegovy, which is the newer one, that one would go up. Like the max dose for Wegovy goes up quite a bit. But I saw actually today an email about it being a bit reduced again. So that one was the most expensive one. Everybody was like, oh my goodness, I can't afford this.
Yeah.
Because that went up to like 5,000 Rand per month. Per month. So
that's just for the pen.
That's excluding like your gym and your food and all of those things.
Not in this economy.
So that was very expensive. So it's definitely a lot more affordable now. And then the Mounjaro, like I said, is the dual action. That one is a little bit expensive also. And like I said, quick pen is more expensive than the actual vial that you draw up from. So it really is just a conversation that needs to be had. Whenever patients ask me which one is better, I go through this whole thing. I'm like, what do you want? What's your goal? How much can you afford per month?
Yeah.
Because it's going to cost you. But being unhealthy and being obese and getting diabetes and getting hypertension and cholesterol is
it's
more
also
expensive.
going to cost you. Yeah.
That's more expensive at the end of the day. So I'd rather have you invest in your health and get better before.
Do you think this is a tool to, because you keep on going back to, like at the root of all of this is the obesity. That's what we need to tackle.
Yeah.
And, that's not just talking about, the weight. It's also how somebody thinks about food and themselves in a mental and emotional way.
Yeah.
Is this a tool to get to dealing with that? Do you think, can we get there by using this?
Yeah, I definitely think what you'll hear people say is that it switches off the food noise.
I've heard that.
Yeah, so and that I've definitely seen with my patients. So a lot of them are like binge eaters, like they need to eat if they're feeling stressed or sad or frustrated, or so they're eating their feelings. And a lot of them have not needed to do that anymore because they were actually, like I said, the GLP receptor in your brain tells you are full. You don't need it.
Yeah.
You actually are fine. It tells your stomach it is full. It does not need extra food. I think that, like I said, with obesity, it is it can affect your mental health. And I do see lots of patients who are deeply depressed by their weight.
Yeah.
And it does help them actually get to a point of being better, because it sometimes everybody thinks it's just just stop eating the bad food, but they actually can't. It's actually a chronic condition that they actually, the same way they can't control their high blood pressure, it's the same way. And genetically, you can't change things sometimes. So I would say that it can help them get to that point.
Okay.
I've definitely seen very good results with patients where they just feel more motivated. They feel holistically, they feel better.
Yeah.
The headaches that they used to get, the blood pressure is better controlled, the back pain that they used to get, the random knee pain, it all goes away.
Wow.
So that's why holistically it makes them feel better.
Okay. Maybe it is a little bit of a magic pen.
A little bit, maybe, but not on its own. So on its own. So I would definitely say, like, cut out like greasy foods, like eat the, like the 7 colors. So the healthy diet with the lifestyle changes of exercise. And the support, the behavioral support, I think goes with it, which is something that in our practice we're very big on. I'm not just going to give you one thing and just hope you get fine. We actually do follow-ups. We actually check in with bloods again. We do a check-in, a weigh-in. It's a journey. It's not just a quick fix.
No, definitely. So listen, we want to give all the facts today, right? And I feel like we've been speaking a bit about, the good side of it, and just to venture a bit into what can happen, maybe like when we're not monitored correctly. So what are the negative things that you've seen? And just something to point out, I mentioned to someone the other day that I know someone that's using Ozempic, and for me it's sort of a thing of you need to know when to stop.
Yeah.
Because you start seeing these lines, I don't know what you call it medically, but like on the face, and sometimes it's just people going too far.
Yeah.
So who's helping with that? You know?
And that's why I think it's important to actually have a doctor guiding you through it, because we will actually say, okay, you've now reached your goal weight, well done, it's done now. Like you can actually maintain it with your lifestyle now. There are other options, like if patients are now really, especially because it depends how tall they are, how their bone structure, how much muscle they have, are they actually exercising? So I think it is important to have the follow-ups. They call it like Ozempic face, by the way, that people
Ozempic face, okay.
So we have seen patients that they become a little bit obsessed with the losing of the weight. And that's why at the very beginning, my first question would be, what is your goal? And if we've gotten to that goal, you are now fine. You are done now. Now you need to go and maintain it with your lifestyle. There are other things on the market, other tablets that doesn't have to be injections, that I have also prescribed before, that can just help as like a maintenance, which is just 1 tablet a day, and it just it works in a different pathway.
So it's like curb appetite.
Yes, just those types of things. Because like we said, it is where patients they can't control their eating, and they really just want to, when the stressful, life is stressful, so they just need to eat. So there are some tablets that are on the market, not injections, not GLPs at all. Some of them actually come with an antidepressant, even within it, which I've seen to also help a lot. So it adds the happy hormones, plus it is reducing your appetite. And telling your brain that you're full, so you don't actually you don't need the bad food. And that, like, you just switched off. The food noise is just also switched off. So I think that we must get to a point where we say, okay, you've now reached your goal. Yeah. It gets to where you can become, then you might get like the dizziness and those types of things, and where they just actually are metabolically now not healthy anymore. Yeah. And it goes to the other extreme. Yeah. So I definitely would stress that nobody should be getting anything without a prescription, without speaking to a doctor about it, because the monitoring is so important. And if it's unregulated, then you just go, because we don't know what's going to happen. We don't know if what you're using will cause you to go blind or will do this, or it will. We haven't seen like extreme cases of anything as yet, but I just think we don't know, because we're not even sure that what you have injected is actually a GLP. Yeah.
So, Doc, what can people do? Because you hear of stories where people go to a hair salon and the hairstylist that's doing their hair is also the person that's selling them this GLP-1 treatment. Yeah. What can you do if you know about this? And I also actually want to speak to someone that's accepting that treatment from someone that's not a medical practitioner.
Yeah. We don't know what they're selling. It could say GLP on the box. Even as doctors, so many doctors are still skeptical about the real stuff, about the actual GLPs. So I would definitely say to not buy anything that is unregulated, unlicensed. In South Africa, we have SAPRA. So if you get something and you see that it's not SAPRA approved, it is not safe to use. There are so many things out there. Even, people show me on Facebook that they saw this weight loss product and they're like, "Doctor, do you think I should use it?" I'm like, if it's not on my EM Guidance app that has all the pharmaceuticals that are registered in South Africa, do not. If you do not need, especially with something like weight loss, if it is not scripted, and with our prescriptions, there are schedules of prescriptions. So if it is not some things you can get over the counter, but definitely the GLP things are not something you'll get over the counter. So it should definitely not be sold by a non-pharmaceutical person or non-healthcare professional, because it can do more harm. I have heard many horror stories of patients who bought things from a spice shop or a wholesaler or a beauty salon, and they would have rashes, and so different things can happen. People have ended up in hospital. I would definitely want to stress that it's not safe. So if it doesn't say SAPRA approved, then it is not safe to use. Yeah.
I mean, you don't know what you're doing to your body on the inside.
Yeah. And like I said, with the GLPs, it actually does affect so many things. So you don't know what can actually be happening in your brain, with your heart, in your kidneys, because it can actually affect so many organs in your body. So it's not just about the fat. It actually affects your whole body.
Sure.
Yeah. So I definitely would say no.
Has to be from a medical officer.
Yeah, it needs to be prescribed.
Yeah.
It needs a prescription. And those prescriptions are Schedule 3, Schedule 4 medication. It's not going to be just something that you can get over the counter. Okay. Yeah. So it definitely won't be something that you should be safely getting from somebody who is not a healthcare professional.
Yeah.
Yeah.
I also just think we're seeing really bad examples from, people that we call celebrities and that's on this type of therapy. We can call it that. It's just the skeleton-like figures.
Yeah.
It's just scary that is the promotion of this is healthy.
Yeah. And I think that it's important for everybody to really, when they decide, it's a big decision that you're not, because you can get like that point where you want to be that skeleton figure because you're looking at this rapid weight loss of somebody online. But I think that it's important to not compare yourself, to not try to be what other people are doing, to not try. And that's why I said the behavioral changes are important as well. So it actually goes alongside psychology and actually talking to somebody and speaking through why you actually have this love-hate relationship with food. And you might be eating, but there's actually depression at the root. And that might be where the doctor comes in and, prescribes something, or you do therapy and you actually speak to somebody about it. That's why it really is just holistic. It's not a...
Definitely.
Yeah, it's not just one. It's not in isolation.
It keeps on coming back to that, just the holistic approach. So I'm very happy to hear that this is not something you need to be on for the rest of your life.
Yeah, you don't have to.
It can literally be, for 6 months and I've reached my goal and I feel comfortable to step in a gym.
However, if you don't go back to the gym and you stop it, you will pick up the weight again.
Okay, so let's stand still on that. Because a lot of people say, like, with these diet fads and all of it, when you stop it, you gain twice as much of weight back.
So the endocrinologists say that you do not gain more, but you will gain it back. Yeah.
Okay.
Because the body is designed, it wants to go back to what it was. So unfortunately, that's why I said when we start, you first start with lifestyle, then you add it as support. And when you stop it, you go back to lifestyle and you continue the lifestyle changes. So you are going to have to continue the exercise. So that's why it's a good practice to start from the beginning so that you can actually just carry it on. Because it's a lifestyle change. It's not a quick fix. It's going to be a lifestyle change. So you decide that you are actually making this commitment to
change your
make
life.
your life better, to actually, because everything that food is so bad. Some food that you are putting into your body, people don't even realize what they're putting into their bodies. Every time they actually consume something bad, your body is in such a state. You can actually, some people get very depressed if they eat too much sugar. I don't know if you've seen kids with like just too much sugar.
Oh yes, I've seen that.
They get the hyper, but they also don't know what to do with all of that energy. It's just in excess. It's too much. And every time you actually make your pancreas go into this frenzy, it gives off the insulin, but then it also increases your cholesterol. And that's where you get cholesterol. It's not from the fat that you're eating. It's actually the carbs that's actually giving your blood vessels such a shock. And then the cholesterol comes trying to patch up everything along the way.
So it's what you're eating,
so
not that you are eating.
Yeah.
We need to get you back on a nutrition talk. You and a dietitian, because I think at the root of it, it's really
actually what you're putting in.
What you're putting in your body. That's the next segment.
Yes.
But just so thank you for highlighting that, and that really it's a lifestyle change.
Yes.
I think it's a good move. To move from the point of this is not a magic pen.
It's not a quick cosmetic fix.
Yes, it's work that you need to put in. So I just think in closing, what would your remarks be to a young person that's maybe not even obese, but that's struggling with their weight? It doesn't even have to be a young person; it can just be any human being. That's struggling with their weight, to just lose that couple of kilos. And they are thinking about, do I need this support to kind of just motivate myself to get into the gym, to get active, to silence that food noise. So what would your advice be to that person?
I would definitely say to come and speak to us first. Because every person is different. So the one thing that might work for the one patient might not work for the next patient. And that's why when we talk about the GLPs and patients ask me, which one do you recommend? I would say I don't know what's going to work for you. We don't know. It might be that this one works because the one patient who looks exactly like you does brilliantly well on it, and then you don't actually lose anything, and you're like, this was a waste of money.
This is not working.
It's not working. So it sometimes is a bit of a trial and error, and not to compare to the next person. So don't look at that person and say, I want that, because that might not work for you.
Yeah.
So definitely to come and speak to us, because it might be more than just the weight. Like I said, it might come down to anxiety. It might come down to depression. It might come down to hormonal imbalances.
Yeah.
It might come down to the thyroid that you never knew was a problem, because an underactive thyroid can cause weight gain.
Yeah.
And then you think you need the Ozempic, but that's not what you need. You actually need to
other
control the
medication.
thyroid, and then you lose the weight. So it might be a different medical condition completely, and you just looking at this person online, seeing, oh, they look so thin and they use this, I need that. So definitely it needs to have a conversation, it needs a consultation, and it needs to be a journey that you walk with somebody. So it's not just going to be somebody prescribes it and then off you go and you just carry on. It needs monitoring. So I would definitely say, firstly, don't compare yourself to anybody else. Their journeys, their lives, their genetic makeup, their hormones are all different. Females being postpartum, being, those premenstrual, like PMS, all of those things play a role. So it's not, there's not one size fits all.
Yeah.
It's going to have to be a conversation.
Yeah. No, that's definitely what I'm hearing. And I think just to not get lost in the fashion and trend of it all.
Yeah.
Because I think that's very easy, but to really think about this as a lifestyle change and as a lifestyle change.
Yeah.
So, Doc, thank you so much for keeping it real on the Femme Frequency. And we hope that this will really be educational to someone out there that is using it, but that's also thinking about using it. So thanks for sharing all the facts.
Thank you.
Thanks.